Let's now have a look what options are available after failure of first and second line treatment in metastatic colorectal cancer. On the one hand, we have an tyrosine kinase inhibitor, which is regorafenib. This has been approved in clinical phase 3 trials and has a level of evidence grade 1. On the other hand, there is an anti-metabolic drug, TAS-102. It's acts differently. It's, however, also an orally taken drug, and there is also level of evidence grade 1. The toxicity profiles between these drugs is different.
I think that you are a good candidate for two possible third-line therapies, either regorafenib, which is a targeted therapy called a multikinase inhibitor, more specifically a protein kinase inhibitor, or there's TAS-102, which is a treatment that combines two chemotherapy drugs.
Okay.
Regorafenib works by blocking proteins called protein kinases on cancer cells that encourage the cancer to grow. It also stops the cancer cells from developing blood vessels that they need. So regorafenib is a cancer growth blocker as it aims to stop the cancer growing for a time. It's an oral treatment, so you can typically manage this treatment from home. You take tablets once a day for 3 weeks, and then you stop your treatment for a week, and that's one treatment cycle. Another option is a combined chemotherapy agent known as TAS-102. Now, this is a combination of two treatments that stop cancer cells from dividing. TAS-102 is also oral and is taken within an hour of a meal for 2 sets of 5 days over a 28-day treatment cycle. Does that make sense?
I think so. As I remember, I have had targeted therapy before, but I'm confused. How is regorafenib and targeted therapy different to what I've had before?
Yes, you're right. You've previously had a type of targeted therapy called an EGFR inhibitor. They work in a different way. If you recall, these treatments require intravenous infusions every 14 days. And while EGFR inhibitors can be used in third-line therapy, these are not appropriate for you as you've already received these treatments, so are unlikely to respond as well at this stage.
The key points to consider when you're communicating in this setting are that you have to avoid misleading treatment aims. Explain in lay terms that not every patient will have a benefit of his third-line treatment options, and not every patient is the same. So different drugs work differently in different patients, and you might not predict whether one or the other option is working in an individual patient. When you talk about side effects, you have to tell the patient that not every patient will experience all side effects. However, it's not predictive. When you talk about third-line treatment options, you have to list this option with all the advantages and disadvantages for each drug.
I think that you're a good candidate for either regorafenib, which is a protein kinase inhibitor, or TAS-102, which is a treatment that combines two chemotherapy drugs.
Okay.
Regorafenib blocks protein kinases, so inhibits cancer growth. It also stops the cancer cells from growing blood cells that they need. It's oral treatment, and you can manage this treatment from home. The treatment cycle would involve oral administration once daily for the first 21 days of a 28-day cycle. Another treatment would be TAS-102, which is a combined anti-neoplastic agent. It is also orally administered twice a day within 1 hour of a meal for 2 sets of 5 days over a 28-day treatment cycle. You've previously had a type of targeted therapy that was an antibody against a protein called epidermal growth factor receptor, or EGFR. Antibodies against EGFR work by attaching themselves to proteins called EGFRs, which are on some cancer cells, which stops the proteins from reaching the cancer cells and therefore stops them growing. As you may remember, these treatments require intravenous infusions every 14 days. While antibodies against EGFR can be used in third-line therapy, these are not appropriate for you as you've already received these treatments and aren't likely to have an optimal response at this stage.
So how do I know which is best for me?
Don't worry, I can advise.